Hello, everybody. My name is Todd Villeneuve, Managing Partner of IFC National Marketing. This is our second State of the Market webinar, and I'm going to be honest, I'm a little anxious, a little nervous. I was so nervous kind of coming up here to get things ready and do this right for you guys. I left my blazer and my shirt on my plane, on my flight up here. So this morning I quick ran to Target. I don't ever really shop at Target. And to be honest, be ready, I bought this shirt, the tag's still on it.
Hey, Todd, does that say XXL on your thing?
You're such a dick, Mitch, by the way. Anyhow, but I'm excited about this, and I'm really happy to talk to, this our first one is to our Minnesota badass agents, and I have a reason why I call you that, is I didn't quite get it. Last fall when I talked to you guys, I said, man, you didn't take a Hippocratic oath. I didn't tell you that you had to talk to all of these hundreds and hundreds of people and be able to get their plan set up. And I didn't expect you to have to do it for free. So what I found out is that you guys just do what's right. And that's badass. That's important. We have about 1,700 agents in Minnesota, and I thought we'd have people bailing in this industry, even though it's a fantastic vocation. And you know what? Only 2 people did. Only 2 agents out of 1,700 that we work with in Minnesota that we know that actually threw the keys on the floor. They were towards the end of their career, so it kind of gave them a pathway out. But, you know, we're working with them. We have a few other people that are looking at saying maybe that AEP was a little tough. We're looking at maybe a succession plan, but I don't know how you feel, but I feel like I came out of a nightmare, like a Medicare nightmare. And actually I have those sometimes where I woke up and I go, oh my God, the worst thing could possibly happen in this dream I had. And then I looked at my checkbook and I'm like, shit, it actually happened. But you guys did it. You have a calling. So I looked up the word calling, and calling, I'm going to read to you, is defined as a strong urge toward a particular way of life or career or a vocation. And if, Todd, if you want to use that in a sentence, I would say those who have a special calling to minister to others' needs. Wow. You guys did that all fall and did it in spades. I am so proud to be able to work with you guys, call you friends, and see you guys be professionals when it really mattered the most, and you did it for free most of the time. Now, I know you have stronger relationships because of that and stronger things, and you guys sold tons of different product that you didn't. We saw hospital indemnity and ancillary products just blow up because you guys found a path to make some money and be able to monetize some of the relationships. So today's agenda is going to be set in a fashion where we're going to try to tell you what's coming up in this next cycle from a lot of experts that we're talking to. We're also going to talk about new ideas that now, since we're starting to get this new skill set that we're cross-selling and talking about different products, how you can leverage the fantastic staff at IFC and our materials, and how you can leverage that to even now use this skill set to expand and grow and monetize your business and scale up better. We have a wonderful agenda. We're going to start. After I'm done here, I'll be introducing George Dipple with Def Research. He's going to talk about what we found out through the fall. And then almost everything we bring up today, we're going to have in slides or in links embedded into the landing page or in the webinar itself. But what I really want to make sure you guys take away from this is how much we appreciate what you guys do. I realize it more now than ever, and we are super, super proud to be able to work with you. And if I can tell you one thing we're going to do is we're going to always try to drive real information, true vetted information to you as quick as we can and give you ideas that you can talk about. So let's bring on George. And from George, it's going to go to Ryan Kimball. Ryan Kimball is the head of president of health distribution for all of Integrity. He's in Washington, D.C. He's talking product design. He is a very, very knowledge leader in that fact. And then going on to Chris Kalowich, who will talk about MedSup and the future of MedSup and how that might be super exciting as opposed to us thinking it might be a problem. Then we're going to get a carrier panel with our friends from Medica, Alina, and Blue Cross Blue Shield. That'll be hosted by somebody you're very familiar with that we just brought in. Then we'll talk about marketing over here and some cross-selling ideas and how to use this new skill set so you can gain momentum and keep using this skill set, and we'll offer other products and other options. Then we'll come back to an agent panel. We'll find out how some of the most successful agents that we worked with muddled through and worked through and had their calling and what they're doing to do now going into this fall or this summer and this spring and this fall and what they're going to scale up and do and best practices. We'll do some Q&A, have a little fun, but most importantly, try to teach and give you information that's pertinent to your families, to your practices, and everything you do. So you're done talking to the fat bald guy. So let's go to George Dipple and hear from him, the man from Deft.
Let's talk about the other side of that coin. What unforeseen events happened, and what do you believe caused them? And I think you might have a visual for this answer.
You're right. I do have a visual for this answer. And so what I would say is, yeah, like known issues that we had going in the AP, we thought seniors were more frustrated than they've ever been before. What we don't know, and we don't know this until the whole market knows it, is basically on 10/1 when all the new benefits come out. And leading up to that time, right, we knew that the senior was frustrated. We wanted to see what exactly the carriers were going to do, right? And that was, I would say, was the big surprise. So if we have a chance to put that slide up, slide 1, we took a look at what happened in terms of carrier disruption, right, leading up to the AEP. Now, this chart is a little bit of an eyesore. So I hope people aren't watching this before they've had their morning coffee. But one of the things that we do every year is we say, okay, how much more change, either good change, so think positive green numbers, or bad change, are consumers and states feeling when the new benefits come out on 10/1? And like I said, we knew from the senior that they were frustrated, but the piece that we don't get until 10/1 is what are the carriers going to do? Are they going to degrade benefits? Are they going to increase benefits? Are they going to pull back out of the market? Are they going to make plans suppressed? Are they going to go non-commissionable? And what this chart shows on a state-by-state basis is when you think about how things were 2024 leading into 2025, and then compare how they ended up being 2025 to 2026, this tells you the change year to year. All right, so what these numbers mean is anything that is 0 means if you are an agent, let's say you're working in the state of Indiana. You look at Indiana, it says -2. What does that mean? This past year, it was a little bit more disruptive in Indiana than the year before, right? But not a whole lot. If you look at a state, let's say like Florida, 0. They had the same amount of disruption for 2025 as they saw in 2026. You look at Georgia. Georgia was really hammered for 2025. It's not as disruptive in 2026. But the point here is, when you're comparing disruption, was it positive, was it negative, and how did this year compare to last year? There isn't a whole lot of green on this chart, okay? There's not a lot of states where IFC agents work where you could say this year was less disruptive than last year, okay? There's a whole lot of red on this chart, okay? And that's what we learned on 10/1. The degree of the benefit disruption, right? The number of non-commissionable plans, the number of exits. So when you look at those red bars, the deeper the red, the more negative the number means this year was significantly more negatively disruptive than last year. When you take a look at that chart, okay, most of the nation saw things get harder for this year than last year, right? But no one really had it harder. I mean, you could say the DC did at -45, but Todd, no one really had it harder than the agents and agencies that are committed to serving the seniors in the state of Minnesota, okay? It was a tough year. That's what we didn't see coming. We knew that seniors were frustrated, right? We had the non-commissionable announcements. We saw the benefit degradation, right? And that's what we saw. It wasn't just the seniors that said, I'm out, I'm frustrated. The carriers had to degrade benefits. And that combination led across the entire nation to more switching in Medicare Advantage this year and Medicare overall than we have ever seen at any time in the 20 years that Deft Research has been in this industry.
Yeah, we look at this and I look at some of the national trends, and I'm seeing a lot of red and a lot of dark red. I know what happened here. The largest failed, when I say here, I mean Minnesota. The largest failed network ever in the history of mankind. But 186,000 members sent back into the populace, and there's just a ton of negativity when it comes to some of that. And what would you say in regards to this industry and obviously this fantastic profession? What kind of keeps you optimistic after you build a slide like this, kind of coming into this next AEP?
You know what? We have another slide for that. If we throw up the second slide, what I would say is, right, and I've been doing this a long time, and Dev Research has been doing this a long time. But we've never seen as much disruption in these last 2 years. Okay, we just have never seen this level of disruption. You go back a long time, 2013, 2014, it was pretty bumpy. Those 2 years, we had between 5% of the Medicare Advantage market termed or 3%. And those were record terms. Hey, last year, not this year, last year, we had 9% of the market had their coverage termed. This year is 12%. So we blew away the quote unquote disruption we had a decade ago with what we've seen these last 2 years. And what I would say is, there was every reason this year, disrupted plans, suppressed plans, reduced commission, eliminated commission, threats of non-renewal commission, all that negativity. There was every reason in the world for seniors to not receive the same level of service from the independent agent as they would expect or need. Right? You can make that argument. There was every reason for those two entities to separate, right? The non-commissionable action is meant to separate agent, right, from consumer. But the reality is, when we look at this slide, there's never been a year where more seniors as a percentage in Medicare Advantage were serviced by the independent agent. That 24% number there is a record. And what we know from the work that we have done at Dev Research, the more disruption that happens in a market, the more the senior has to find their guardian angel to assist them. Right? When things are smooth and your benefits don't go down and your costs don't go up and you don't see plan terms and cross, when everything is hunky-dory, as a senior, you can make an argument they don't need as much help. They don't need as much of a guardian angel. But when the what hits the fan, and I can't swear, Todd, so I'm going to say when the what hits the fan, you can swear, this is your podcast, right? But I can't. But when the what hits the fan, that's when the senior needs the guardian angel. Our research tells us there are 3 potential guardian angels that a senior can reach out to make sense out of a very disruptive market. Number 1, the government, Medicare.gov, talk to people at Social Security, et cetera. Number 2, the carrier. And then number 3, the agent. What we know at depth is when the senior is more serviced by the agent, as you see on this chart here, the bond between senior and agent doesn't weaken. It strengthens. And I think at the end of the day, what the final chapter in this book is going to read, it's going to say that there was rampant disruption, this period of tough rates for carriers and all these challenges with higher utilization. But what that disruption did is it made more valuable the services that the independent agent provide, despite the fact that the industry may have been trying to separate agent from consumer. I think that is going to be how the final story reads when this disruption is finally past us.
Absolutely. I think the result or the unseen or the lurking variable, using my Six Sigma training, George, there you go, is that the agents sold the right product, regardless of commission, when it came right down to it. I'm looking at your numbers here. When 90% of the plans across the market had changes, that means 90% of those people had to have a conversation with an agent. And the other couple of stats that jumped out to me here is, of the people that used agents, 83% of them were multi-product. They were solution-minded, had a full portfolio of options for their clients. So I think the hang one flag on the mast is kind of days gone by. When you start to take a look at some of these things.
Hi, everybody. My name is Ryan Kimball, president of Integrity Health, and it's a pleasure to come to you, IFC agents, to talk more about what's going on in the health market. To give you a little bit of background, so I've been licensed since 1996, which feels like forever ago, but that's when I got started in the insurance business, selling individual health policies at that time, and then worked in a business that ended up being a brokerage to where we worked with agents and agencies throughout the early 2000s in the Medicare space, specifically on Medicare supplements, and we still did a bunch of under age 65 individual medical and group. And then, as most of you know, once Medicare Advantage and Part D came out, a lot of us got in that marketplace. So for me, my history goes back to the health space. In the under 65 and over 65 space, I have the pleasure of being Integrity's president of the health side of our business. And that includes all the health products that you all sell today, as well as some of the products that you may not sell in the group space. But we work on the Medicare Advantage, Medicare supplement, over 65 ancillary products, as well as the under age 65 ACA plans, and then the ancillary side of the house too. And so what my job today is to talk to you guys more about what's happening in health insurance for 2026, maybe look back at 2025, give you a little bit of an overview of what we saw, and I think what we see is good momentum rolling into 2026. So let's talk about the last 2 years for a second. So 2024 and 2025, as you guys know, have been the most disruptive eras or times of the year for Medicare Advantage. I've been doing this since '05. In 2024, we saw 1.7 million Medicare beneficiaries go through a service reduction. In 2025, we saw 2.8 million Medicare beneficiaries go through a service area reduction. So these are members losing their plans. A lot of that is a result of the Inflation Reduction Act and how carriers ultimately were positioned in the marketplace. It's also a result of continued increases in the MLR side. So the medical loss ratio for insurance carriers is at an all-time high over the last 2 years. But what we see today, though, as we look at 2026 is positivity. And that's in the Medicare Advantage space in a few different areas. So first, as you guys know, the Medicare Advantage population continues to grow. Our Medicare over 65 group will be at about 70 million Americans in 2027. So we're still on that growth trajectory. And the good news is it continues to be complex. And the complexity around that puts insurance agents like you all in a great position to ultimately help Medicare beneficiaries. Now, we are challenged at times with both commissionable, non-commissionable plans, pullouts, and maybe disruption in the marketplace. But being in the center of it all and being in a position where you can help, one, your current members, but also your future prospects, puts us as an industry and you individually in a unique position. You're a trusted resource for Medicare beneficiaries as they try to go through the decision-making process on what's best for them. So front end, we have 70 million people coming into the marketplace or that are in the market now. You have a complex marketplace where the insurance agent is that trusted resource. We have technology today that makes agents more efficient, and we continue to see AI helping us do that. So if you're not using Integrity Connect, this would be a plug to start using Integrity Connect. We see from our data agents are 79% more effective by using the Integrity Connect. That comes from an efficiency perspective and your ability to help Medicare beneficiaries. But the last thing I would say in the Medicare space is that we also see CMS, through their proposed rule that came out a couple months ago, really look at insurance agents as the key to helping Medicare beneficiaries understand their options. And then two, trying to change some of the rules around how agents engage with members to make it easier for all of us. So I think one, you have an administration that supports Medicare Advantage. I think two, we have an industry that's obviously continues to grow and it's big in scale. Three, we have technology that's helping us, ultimately be more efficient in that marketplace. And then lastly, I think we have a scenario where, again, the administration's putting us in a positive position to help Medicare beneficiaries as we go forward. So 2026, as we go through the year, we'll be looking at what happens in the AEP of 2027. And I think we'll see continued, maybe a downward turn in disruption, which means disruption is a little bit less, even with the most recent rate notice. So that's positive. And this fall coming up, we'll be able to help more beneficiaries as we go through the process. So you guys do an incredible amount of work. I think it's maybe at times lost on the industry how important insurance agents are to each Medicare beneficiary, but I would encourage you to obviously lean into Medicare Advantage and lean into Medicare supplements and continue to help those that are underserved and maybe need help in the education process to learn more about what's happening and what they can choose. Now, maybe speaking about Medicare supplements for a second. So the Medicare supplement market is similar to Medicare Advantage in the fact that that market continues to change from a rate and pricing standpoint. The good news is the last 2 years, the carriers have continued to increase rates and become more stable, which what we see from that perspective is we see more carriers wanting to get into the Medicare supplement space because now they can be profitable. If you don't know, Medicare supplement companies, when they come in, they're on a trajectory of trying to get to profitability on a member at like year 6, 7, or 8, and sometimes that gets extended to year 10. So as you can imagine, insurance companies want to make sure that the market's at the right price point to then be competitive. And we've seen that time and time again. We see it now. We see the carriers continuing to be in a position where rates are starting to be more competitive and starting to float up. We see more carriers wanting to come in the market. I think what that'll drive is overall competition for the states that you're in or the markets that you're in to help consumers ultimately get in the right product. We see obviously huge success in some of the standardized plans like Plan G. We see agents moving to Plan N as well as they're trying to reduce costs for Medicare beneficiaries. But we are a big believer in Medicare supplements. We continue to help carriers build those products. And I think as we continue down the path, Medicare supplements will be a strong product for seniors to choose, especially those who don't have the same affordability issues as those that are jumping into Medicare Advantage product line. So for us as insurance agents and maybe advisors for consumers, Medicare supplements continues to give you that alternative choice relative to Medicare Advantage and helps consumers in a way that Medicare Advantage can't. And I would continue to have that as part of your portfolio of sales options as we think about how to serve Medicare beneficiaries in the right way. Ancillary products for a second, I'll talk about those both over age 65 and under age 65. Last AEP, so the thing about, just about 2 or 3 months ago, we saw a huge rise in ancillary product sales. And predominantly it's where agents who are working with consumers in the Medicare Advantage space understand that those consumers need to have access to these products. At times it's dental insurance, at times it's cancer, a lot of times it's hospital indemnity insurance. And these products help offset some of the gaps in Medicare Advantage primarily, or maybe even some of the product options that Medicare Supplement doesn't offer when it comes to dental plans. And I think as we kind of move forward, insurance agents continue to understand that if I don't offer these products to my consumer, somebody else will. And the consumer needs to be served. I'm the trusted resource. So I want to make sure that I understand when a dental plan is the right fit, when a hospital indemnity plan is the right fit. And obviously the team at IFC can help you guys better understand of one, how to open up that conversation, and then two, how to make sure that product is the right fit at the right time, and ultimately the consumer gets served. So back to the ancillary products, the good news is we continue to see a ton of sales growth in that market space, both over 65 as we're supporting Medicare beneficiaries, and then under 65 as we have those in the ACA space and those that are ultimately maybe on ACA alternative products. And maybe to turn our focus to ACA now. So that market, as you know, continues to evolve. Now we have a good sense for what's happening on the subsidy side. And I think what we see in the ACA space is a mature market now. We have obviously more people than ever enrolled in an ACA plan. And the unique thing is that insurance agents are in a position where now they are helping about 78% of those members enroll in those plans. So if under age 65 and ACA is something that you're not in today, I would definitely encourage you to do that. As we all know, when a husband and wife turn 65, they don't do that on the same day. So a good chunk of our customers are under 65 when we first meet them, and your opportunity to help them with the ACA plan also puts you in a great position to then transition those members into Medicare when they turn 65. But we see ACA as a blossoming space when it comes to how agents can ultimately be a really important source of truth for under age 65 individuals. And we see the CMS side of the house promoting insurance agents in that marketplace too. They just came out with their proposed rule. I think there's some really good things in that proposed rule that'll help agents kind of be better positioned going forward. And I think the rule changes are really to help get some of the bad actors out of the ACA space. And so Short story is if you're in ACA, you already know the story on how good that market is and how much you can serve people under 65. If you're not in the ACA space, and I would really encourage you to get into that marketplace because you're serving the same type of customers. Their ages are just different, and those products look and feel very similar to Medicare Advantage. And you have an opportunity as an advisor to help those people make sure they get in the right plan going forward. And I think we'll continue to see with this administration, more positive things coming out of the ACA space. It'll create more competition, better pricing, and again, agents being an important piece to the overall strategy for ACA. So long story short, 2024, 2025 obviously had challenges. Several markets like Minnesota and others saw maybe more challenges than the rest of the country. We do see, though, that agents are continuing to be ensconced as like the truth source for Medicare Advantage beneficiaries and those that are under 65. And I think the tailwinds that we have is that we have an administration that continues to look at ACA as a way, how can we innovate on the ACA side? How can we come up with new products and new opportunities that'll create more competition and better products and solutions for your clients? And I think on the Medicare side, Medicare Advantage side, is you continue to have carriers that are now getting stable in that marketplace, which means we should see a reduction in plans that are either non-commissionable or those that have service area reductions. So good things to look out for 2026. I think the market on both sides continues to stabilize. And the last thing I would say is I would encourage everybody to be active. Like be active in your state with NABIB, NAIFA, HAFA. We do a lot of work with those three associations, both at the state and local level, but then in DC. I'm scheduled to go to DC in a couple weeks. Meeting with NABIP and ultimately meeting with some of our folks on the House and Senate side to drive better outcomes for insurance agents in the marketplace. And I think all of us, as what I would say is entrepreneurs, have our own little business that we either big, medium, or small, but we're trying to grow and do our own thing. At times, as an industry, we don't come together as well as we can. And if we do that, then we can let our voices be heard at the state level and then at the national level to create the change that we need to see to make sure that our industry continues to blossom. So good things ahead in 2026. I hope you guys have a tremendous conference. Thank you guys for all you do. If there's any way I can help, feel free to reach out. LinkedIn is the best way to get a hold of me. More than happy to help in any way possible. And I wish you guys the best of luck in 2026 and then into the enrollment periods for 2027. Thanks, everybody. Ryan Kimball signing off.
Hello, IFC agents. Chris Collowich here, joining you guys virtually. I'm so excited to be with you all today. Todd had asked me to come on and talk a little bit about the Medicare supplement market and really the overall Medicare market in some ways and how we're viewing and particularly bullish on some of the things that are taking place in the Medicare supplement market. Just to give you guys a little bit of background on myself. I've been in the industry for several years now. I actually started in this industry. It's all I've ever known. And when I first started out in the business, I worked for a brokerage, very similar to IFC. We partnered with Integrity in 2017. And during that time, I've worked in account management. I've worked in sales, both with agents and also with customers. And then really had more formative years that I spent in product development and particularly Medicare supplements. And what is that, you may ask? Well, what we primarily did is we worked with carriers to bring new Medicare supplements to market, whether that be the first time that they've entered the Medicare supplement space or they've already had an existing product and they wanted to go a little bit deeper into that segment. So we've worked with actuaries, we've worked with marketing teams, we've worked with sales teams and administration teams, underwriting teams, you name it, to really understand end-to-end the whole process of bringing a great Medicare supplement to market. And during that time, obviously, I've built a lot of great relationships with carriers and continued to stay in touch with them. And I think more particularly in the last few years, their actuarial teams. As we've seen the Medicare supplement market go through a number of changes in the last several years. And just real quickly, just to give you guys a little bit of background on what we've seen, particularly in the last 5 or 6 years or so, and why it's led to the moment in time that we are today. And I think that's important as we think about moving forward, what that looks like. So we go back to even pre-2020, we saw Medicare supplements moving towards this moment where we're going to have a macro environment, post-macro environment come 1/1/2020. And what that meant was folks that were aging into Medicare post 1/1/2020, Plan F was no longer their guaranteed issue plan. It was going to be Plan G. So we saw folks started moving to Plan G prior to 1/1/2020, and then that further accelerated as we moved into 2020. And if you guys remember, obviously 2020 there was a global pandemic that took place that year, and Medicare supplement market overall was heading for really a rate reset leading into that. But what that did was further delay that reset. And as we think about what carriers are able to do when it comes to their rates as from a year-to-year basis, all their rate changes have to be based on claims experience. And what 2020 did was actually decreased all of the claims that carriers were seeing. So they were not able to take rate adjustments that were commensurate with what the overall book had. And so as we come out the tail end of COVID in 2020, there's really this catch-up cycle that carriers have been going on. And that's what's led to what we've seen of double-digit rate increases for the last several years. And I think it's important to add in context is we've looked and worked in this space for many, many years. The market tends to do this over time where we see high rate increases and then it starts to go back down and gets ultra competitive again with more carriers entering the market. And we're just in one of those unique moments of time. So I really wanted you guys to understand kind of what is taking place so that you guys can best explain it to your clients. And if I had to just say one thing for each and every one of you related to that is this is a unique moment in time. And it is not one that we anticipate extending much longer. We've met with several carriers in the last few months. They feel that they're right on the tail end of this, meaning that we may see new product entrants into the marketplace in the next 6 to 12 months or even 12 plus months that carriers will file for new paper. And that's a great sign for the healthiness of the marketplace overall. What I would expect for 2026 is another year of double-digit rate increases. But that's okay, right? Because we feel we are on the tail end of this. And the one thing that I would say during these moments when you have a lot of disruption, we saw it on the MA side, but when we have a lot of disruption on the med sup side, it's great as an agent for you to continue to solidify and strengthen the relationships that you have with your current customers, but also go out and find new customers. Now, where do you focus your time during this? Well, we know from our buddy George Dipple at Deft Research that folks just aging into Medicare, really 65 to 68, those first 3 or 4 years in Medicare are critical for retention for the carrier and also us as agents, right? And so your clients that are newer to Medicare, focus on them during these disruptive times. The folks that have been in a Medicare supplement for 7, 8, 9, 10 years, well, they're most likely going to stick there because that's just what they're accustomed to at this point. You may want to check in with them, obviously, during an annual review and see if they have any curiousness of what the marketplace looks like and see if you can get them into a new plan. But ultimately, primarily, if you have limited bandwidth, focus on those newer customers into Medicare and then also focus your marketing strategies around folks that are that age as well. And you'll generally see a higher return from it. Overall, as we look at the marketplace moving forward, again, I mentioned 6, 12, maybe 18 months where we start seeing the market come back down to normalcy. We'll start to see carriers be a little bit more aggressive in their pricing. But that does mean that we've got to continue to exercise that muscle and continue to work with our customers on Medicare supplement because that moment's going to happen pretty quickly. It'll be here before we know it. And you want to make sure that you're prepared for it. Even during these moments where we continue to see Medicare Advantage grow, we've seen Medicare supplement grow as well. We have over 5.6 million lives that are now on Medicare supplement plans across the country. And that continues to grow at 3% year over year. So folks are still choosing Medicare supplement for all the reasons that they've always chosen it, right? Freedom of choice of being able to go to any provider, any network, any hospital without prior authorizations, right? To be able to have a little bit of peace of mind around if I continue to pay my premiums, that plan will continue to renew year after year after year. So again, continue to instill that into your customers. Folks are still gravitating towards those plans. One thing I did want to share with you guys, particular to the Minnesota market, we saw a lot of disruption in Minnesota. this past year, particularly during AEP, and maybe more so specifically with UCare. Now, I was just with a carrier last week meeting with them, and we were talking about Minnesota specifically. And I said, hey, what are you guys seeing about or thinking as you guys received all this business during the AEP? Is there cause for concern because of any adverse selection that may have taken place? And they said, first 2 months look great. We believe our plan was priced in the right spot to be able to absorb as much of that business as we got, in even wanting to take on more. So for me, that's an incredibly encouraging sign as you have these unique moments where folks are moving from MA to MedSup and you really don't know what you have. But for this carrier, a big name carrier in the space, to say that adds a lot of confidence into what we see overall in the marketplace. So as we think about other opportunities in the marketplace, INA, Medicare Supplement, a great MedSup that continues to be a leader in the industry. If any of you are working in birthday rule states, you'll see that INA is paying full commission for the lifetime of the policy in all of those states. And why is that, you may ask? Well, as we think about birthday rule states and how impactful they've been the last few years in Medicare Supplement, and the sheer number of them that have entered into the arena from a Medicare Supplement perspective, carriers want to make sure that they want to make sure that they're able to price for the appropriate risk that they're getting. And with a birthday rule state, that generally makes it a little bit more difficult because folks are moving from the lowest plan to the lowest plan every year, no health questions asked, right? It's great for a customer in one sense because they're able to move from plan to plan to plan. But overall, what happens is the marketplace continues to rise and rise and rise. So what INA was able to do, and you guys may be familiar with the brand Chubb, they're part of the Chubb company, is they're able to add in lifetime commissions for those birthday rule states. And so for you as an agent, what you're able to see is not just years 1 through 6 or years 1 through 7 that you're going to receive your elevated comp. You're going to receive that same levelized comp for the life of the policy. And so as we continue to see members get rate increases and those continue to tick up, not only are you going to receive the comp as those members are continued to be retained, but you're also going to receive comp on the increases of those policies. So let's just make as a quick example. If you're receiving 15% commission and you're receiving on a $1,600 annualized premium, well, if someone gets a 10% rate increase, they're now going to be at $1,760 annualized premium. You're still going to receive 15% commission, but it's now on this higher premium amount. So a lot of great examples of what some carriers are doing to be a little bit more innovative in the space and adjusting to the marketplace. INA is one of those. As we continue to bring products to markets with carriers, we believe that strategy will be something that we want to continue to layer in for years to come, because we believe it's going to be a healthier book of business for the carrier. It's going to allow for you as the agent to retain your book of business and focus on growth rather than rewriting your customers. And overall, it's just a better member experience if they're not having to switch year after year after year. And we're able to continue to serve more and more people. So just wanted to give you guys a few quick nuggets today. I appreciate all that you guys do and want to say that to Todd and the entire team, thank you guys. For all the agents out there, listen, the last few years have been incredibly disruptive. You guys have absolutely killed it. Continue killing it. And there's no better partner to do it than with IFC. Thank you.
Welcome to the IFC Carrier Panel. I'm Chris Lopez. I'm the National Sales Director for Medicare and Health. I'm new to IFC new to the IFC family, going on about 6-7 months here, but I'm not new to the healthcare industry. I've been in the healthcare industry going on 29 years. The majority of that time has been with Blue Cross Blue Shield on the carrier side, but out of those 28 years there, 26 were working with agents and brokers. So we apologize for the technical difficulties. We want to remind everybody, for any questions that you have, please put in the chat, whether it's on the video or any of the segments that are coming up. And make sure you refresh your screen. Sorry about that. So go ahead and refresh, and then you can go ahead and have that chat. And we will be answering questions that we can. If we do not get to any questions, we will be putting out an FAQ for everybody after the event today. So this is our carrier panel. Unfortunately, a couple of our carriers from Health Partners and United were not able to make it with us today, but we're very glad to have Brad, Denise, and Jerry with us. So Brad, welcome.
Thank you, Chris, and thanks to all of you for joining this morning. Sorry for the trouble, but appreciate you coming and hearing what we have to say today. So Brad Larson with Blue Cross Blue Shield of Minnesota. I am the Director of Sales. I've been there for just over 13 years and happy to be here.
Hi, I'm Denise Decoder, and I'm a broker manager with Allina Health Aetna. I have been in the industry, goodness, over 30 years. Previous to Allina Health Aetna, I was with Medica for 23. So I'll turn it over to Jerry.
Thanks, Denise. Good morning, everybody. Jerry Melgar here with Medica. I'm the Senior Director of our consumer markets at Medica, which means that I am responsible for Medicare, Medicaid, and ACA sales. And just want to thank IFC for putting this carrier panel on and for putting this meeting on. So happy to be here.
Okay, so 2025 was an interesting year. The 26 AEP was tough, so we don't want to rehash that. But I know it's early in the year for you guys as carriers, but what are your early insights into the performance that you have for 2026?
Thank you, Chris. So I would say, the key term there is early. There's a lot of emerging data as of, I think, end of last week, last Friday. CMS just released their landscape data, so we're starting to see what all the carriers did in Minnesota. We're really trying to get through that information. Also trying to get through all the data as far as within Blue Cross takes a little bit longer to filter that, but initial look is Blue Cross just finished under 80,000 enrollments in the state of Minnesota. If you looked at Blue Cross in December of 2025, Blue Cross was sitting at about a 36% market share. That's jumped up to 51%. So from that standpoint, certainly there was a large increase at Blue Cross and in the market as a whole, I think for the carriers that were left. From a standpoint of looking at the state, I think Blue Cross had the more enrollment in the metro as well as the west. When you take a look at the cost counties as well as the south, the enrollment was a lot less in those areas, but I'm sure that we anticipated that. One is, in our cost counties, a lot of that was disrupted through the St. Luke's Aspirus network issues that were going on. And then as well, in the South, we did have some changes to our product portfolio that impacted that as well. When you take a look at kind of the MedSup performance, that data is still emerging. When you look at MedSup and the market, in the spring of every year, the NAIC releases data, and it's usually for the year before. So we're really trying to back into what the MedSup numbers, like looking at Medicare Advantage, how many people, did that market decline. So we'll have more numbers coming on MedSup. For MSHO and Blue Cross, we see that there's been some delays with the state of Minnesota and the DHS. And those numbers look like they're delaying to get through to Medicare. So Medicare's not reporting yet on MSHO business for 2026. And then I think lastly is just our PDP product. As we know, we no longer have the Premier product. We did see about 10,000 disenrollments, so that PDP product has declined a bit. At this point, we know that PDP market's under some duress as far as the carriers, but I think that kind of gives you a high level flyby of where Blue Cross is at preliminary at this point.
So, as Brad said, it's still pretty early to really predict the 2026, I guess, financials for Allina Health Aetna, but I will touch on a few things. So given this crazy market this last AEP, Allina Health Aetna had our largest to date enrollment. So we had approximately 26,000 enrollments this AEP, which almost doubled our membership. So big influx of membership for Allina Health Aetna. I would like to mention that the majority of that enrollment was in our top 3 lead plans. So which is Signature, Signature Fit, and Enhanced. And from a financial perspective, those 3 plans have ran very well in 2025. So, we're hopeful that that continues. With Allina Health Aetna, we also have a more narrow network. And so, we take a look at that and are hopeful that that does mitigate some risk from a claims perspective. Of course, it doesn't make us immune, but it definitely does help. So I will pass it over to Jerry now.
Thank you, Denise. 2026 was a challenging year, or is going to be a challenging year. 2025, the AEP kind of played out the way we thought it would when you think of the enrollments and where they came from. So at Medica, we don't just operate in Minnesota. We have other states that we operate in. Minnesota by far had the most disruption out of any state that we're in. I think everybody on the call knows why. But we saw a lot of the enrollments that we gained for 1/1/2026 business come from Minnesota. So when you break that down, we had a really big Medicare Advantage year. Overall, we had about 94,000 enrollments in all of the states. About a third of that comes from Minnesota. And we had cost plan disruption in South Dakota. We had some other disruptions in Nebraska, but not as much as we did in Minnesota. I think what we're looking at now is really taking care of that membership. We and others got into this mess, not mess, but sort of Medicare Advantage looks a lot different because we're not getting the same revenue like we did in previous years. And what I mean by that is there's multiple different ways that a Medicare Advantage carrier makes money off Medicare Advantage, right? You have the stars ratings, you have the reimbursement amounts, and with star ratings, they have been going down since 2022. So if you think back to 2022, there were 74 5-star plans. 2023, there were 56. 2024, I think there were 34. In 2025, there were 7. Why is that a big deal? It's because we as a Medicare Advantage carrier rely on those bonus payments based on how high our star ratings are. And when you take away our ability to hit those metrics, it impacts the bonus payments that we get from CMS. The other thing that we're looking at is the recent announcement by CMS of a 0.09 increase. That's a big deal. Historically, it's not final. It's gone up a couple points, but historically, it started at 3 to 4% and gone up to 5-6%. When you start at 0.09 and you end up at 1% or 2% above that, it's still super low. And so I know we're going to talk a little bit more about what we're thinking for 2027 and beyond, but that's kind of what we're thinking in our mind after this big enrollment is how do we take care of our members now because of the influx of folks that we've received. We need to take care of that membership to be able to hit some star metrics.
Yeah, there's definitely financial pressures with the star ratings and CMS and the revenue that is, being proposed for carriers. So I know we're early in 26 for performance, and I know for carriers we're early for 27 product planning. What is your guys' strategy, or what are you doing right now for getting prepared for 2027 product planning? Jerry, I'll start back with you.
Yeah, that's a good question. We're in the middle of bid meetings, and so the bid process really kind of goes through the spring, and then we file at the end of May. And going into 2027, we really need to figure out how to correct Medicare Advantage, and it's not just us; it's other carriers really dealing with the higher MLRs, not what I talked about with the star bonus payments and the lower reimbursement. And so going into 2027, you have to really figure out how do we get to a profit? How do we become profitable again? And I think you're going to see some benefit changes that are going to impact your members. You're going to see less attention to the value added benefit like OTC and dental and hearing aids, and more focus on your core benefits. Things like copays and coinsurance, your Part D benefits, who's in and out of network, how high is your MOOP going to be? It's going to get back to the core benefits. And, I think that makes a lot of sense. When you think of, and Becky Taylor on my team brings this up all the time, when you think of your, property and casualty insurance agent, you don't get free oil changes or, things like that with your PNC insurance, right? And so I think you're going to see more attention to the core benefits and the premium versus the value added stuff.
Thanks. And I mean, I can pretty much say ditto. This is a question that's probably very similar kind of across carriers. The advanced CMS notice, as Jerry said, it looks pretty grim for Medicare Advantage. So when planning 2027 and we're in these bid meetings, that definitely may have an impact on rates. And Alina Health that now we started to make benefit degradations in our 2024 bid cycle for 2025. And we did continue to make some additional degradations into this, 2026 year. But in anticipation of the Medicare landscape, we've kind of been taking steps towards degradation, so it doesn't, I guess, impact our membership as significantly as it could have if we would have just kind of waited and ripped the Band-Aid off.
So Jerry kind of hit on some of it. We at Blue Cross, we actually had our first 2027 product kickoff meeting in December of 25. So, I mean, the planning that goes into this, it takes half a year. Jerry mentioned that the funding of the program, that wasn't good news. That came out here a couple weeks ago. In early April, they'll actually release, like, historically we've seen the funding go up when the final rate notice is given. So, we're hoping for that. In the meantime, everyone's looking at all this new enrollment that's come on board and how that's impacting the book of business, and trying to predict going forward what that looks like. And of course, what everyone, starts thinking about is premiums, benefits. Premiums go up, benefits are reduced. There's a certain there's certain guidelines that Medicare has that only allows you to change your total combined benefits and premiums a certain amount. And I think carriers are going to be up against that once again, based on this funding news, to really, make some big changes on that. And of course, the first area of focus goes to those supplemental additional benefits. So it's all there. It was happening last fall, and I think we talked about, once the news came out about UCare leaving, that that this was going to be a 2-year ripple, that it was going to take a bit of time to work through this, and it does come down to each carrier's ability to manage the business, right? To take care of these members and what they cost. So just kind of drilling one level down. I mean, we talk about the funding. Well, we're looking at normally like a 4.5 or 5% increase, and we're just below 1, which is almost flat. We we think there needs to be an overhaul of the overall system as well on the funding. And I'll just give you an example. Right now, I mean, we've gone through through the IRA over the last couple of years has really shifted the responsibility and the risk to the plans, and that's where we've seen a lot of movement in benefits. Where talk about co-insurance versus co-pays. We were seeing co-pays on tier 3, 2 years ago. We're not seeing that anymore. It's a co-insurance, but right now the Part D funding really funds carriers. They're actually rewarded on the healthy members versus the sick members, and that really, from a risk adjustment standpoint, doesn't make sense, and it doesn't work out in the funding. So we're underfunded on Part D. So that would just be an example of that funding. But yeah, I think we're gonna keep moving forward, and we're gonna file end of May, first week of June, and we'll look forward to coming back as we kind of go through the process here and provide updates.
Awesome. So, I think all of us have been in the industry long enough. And I think early when I started in, somebody said Medicare is a 3-year cycle. So, hopefully this 3-year, it doesn't get stretched out, and we can course correct in 27, for sure 28. So kind of with everything that's going on, the CMS legislation, you guys talked a little bit about that. Is there anything else that you guys are anticipating that are coming that might impact your 2027 product planning? What are the things that keep you up at night?
Want me to hear Denise? All right. So there's a couple things. I think we're continuing to see, for 2027 final rule, we're continuing to see a focus on what we call the third party marketing organizations, and that's a good thing. So I'm happy about that. But the part that concerns me is when they start doing that, and then it gets all the good agents caught up in that as well, and starts requiring administrative burdens or things that need to be done by agents that are not bad actors, right? And so from that standpoint, that concerns me. I worry about that. Once we get that detail, what that'll look like. I also continue to just worry about stars. It seems like stars is changing every year. Jerry talked about the fact that the number of stars organizations has decreased over the years. So from that standpoint, as an organization, it's very costly to actually strive to be a high star rating, and when the system seems to work against you, that's tough. And then I think the other one is just around you talk about our ability to be successful in managing the members that we have, right? And it comes down to something called risk adjustment, right, where there's coding going on based what the diagnosis is. And there's a lot of news nationally about, hey, Medicare's looking to go after organizations because they think there's this overemphasis on the lift, or having better performance, but not necessarily that the documentation exists there. So there's a new thing coming out in 26. Medicare's been way behind in kind of their audit schedules, but they're going to be performing what they call RADV audits, and that's risk adjustment data validation. And so really they're going to go out to all health plans, and they plan on auditing every health plan once a year, where they're going to look at, hey, here's what the risk adjustment codes were, what does the documentation represent, and do they match? And if they don't, they're going to do clawback. So those are just 3 things that I've been thinking about.
Yeah, I mean, Brad hit them on the head. So, I mean, that advanced CMS notice, which again, we'll know more in April. And then STAR. So the Line of Health Aetna new chief Medicare officer actually was the head of STARS and risk adjustment for Line of Health Aetna. So we hear a lot about that and just how difficult CMS is making it for a plan to attain a higher star rating. So definitely a concern.
Yeah, I I would agree. To answer your question, what keeps me up at night? the stars rating measure is really a big deal. And so with the addition of the membership that we saw, especially in Minnesota, that's what we're paying attention to, is how can we take care of the members that we receive to be able to receive a higher star rating. And CMS is not making it easy. So one of the proposals that they have for 2027 is the addition of additional things that will go into that rating, such as cholesterol screenings. So it's, that's just an addition, another thing that we need to look at and make sure that our members are going in for those screenings. One of the things that I thought was interesting with regards to the marketing guidelines, they're bringing back superlatives to be able to, for carriers to be able to use those. So this AEP, you might hear, hey, we're the best Medicare Advantage plan, or we have the most enrollment. So we're sort of getting more lax on those rules, which I think some of them are good, like the 48-hour turnaround time for the scope of appointment. That was sort of silly, right? You can see somebody within 48 hours if they wanted to talk to you about a different product. So that's going away. I think that's good. But the main focus for sure is taking care of the additional membership that we received to be able to get a higher star rating.
Thank you. So we'll definitely be excited to hear where you guys land in April and May, or whenever you're ready to share with us in the market. So let's just switch a little bit to different product. Medicare Advantage, we know we're going back to basics is what it sounds like for you guys as carriers. And so, I always think it's good when things get crazy, whether you're in sports or whatever, go back to your basics, right? So looking at the Medicare supplement, so we have changes coming in Minnesota with new legislation. So just want to speak a little bit, like, how are you guys handling that? And how do you see Medicare supplement maybe playing a different role in the market with the broker community? Denise, let's start with you.
Okay, so Brad and Julie are probably going to have a bit more to offer. I don't technically work with the Medicare supplement product at Aetna. I know about enough to make me dangerous. I mean, I think we're going to see, as far as Medicare supplement, I think we're going to see a really busy market over. We did this AEP and, into next year, but I do really think that the premium is detrimental to folks. So, I still think that Medicare Advantage is still going to be our primary product in our market, but I'll hand it over.
Yeah, I would agree. There's definitely more attention to MedSup now, especially when you think of the other states that we're in. So in Nebraska and South Dakota, from a provider perspective, they have really pushed a lot of their patients to look at MedSups over a Medicare Advantage. And the reason behind that is the payments that they get. The prior auths are the biggest reason. They have a lot of denials on things that they want to do for their patients. You don't see that with MedSup. And so there is a push from providers in some of the rural states to really have individuals enroll into a MedSup over a Medicare Advantage. I think Medicare Advantage is still going to be very popular, but you will see a resurgence of MedSups increasing in enrollments, just because of some of the things that MA is going through. The GI provision that's coming up in Minnesota, TBD on that. We obviously have to do what the state says with regards to being able to sell MedSup in the state. But that guarantee issue, I think, is going to create some higher rates for those plans because we have to take them on. And so TBD on what that's going to look like, but that's coming this fall.
Yeah, it's just, I think nationally, there's some pretty large health systems, even including the Mayo Clinic, right? They're in Scottsdale, they're in Jacksonville. If you want to go to one of their locations there, if you don't have MedSup, they're not going to see you. There's a couple other national big large providers where they're just like, we know MedSup, and that's who we're taking. So I think there's certainly those aspects on the providers and nationally, and we may see some of that movement in Minnesota, even with Mayo in Minnesota. So we'll see. I think MedSup for sure. is going to have some limelight, I think, or spotlight, just like it did this last AEP. Remains to see how many people moved out of the Medicare Advantage market to MedSup, but we'll have those numbers coming soon. But it also is highlighting little known and little enrolled products like Plan N, high deductible F, right? I think those products are becoming more popular, more visible. So I think we'll see an increase in MedSup on that. As it relates to, I know we're not diving in deep, and I know we're running out of time, but the new legislation that came out that says there's going to be open enrollment here in the fall in Minnesota. There's more details to come on that. I think we'll have that, but I will say this: the large disruption that we just had this last fall and AEP, I think dampens that a little bit, because there's been a lot of movement in advance of that, and people have taken the opportunity to do that. And I would venture to guess there'll be additional disruption again this fall by carriers. So once again, that open enrollment might not be as big of an event as we initially thought. So.
Well, thanks everybody. Thanks for all your insights and for participating today. And thanks for everybody for tuning into the carrier panel. So now I'm going to hand it over to Aaron Dorf with the sales team.
Hello, my name is Aaron Needorf. I'm Executive Vice President of Sales here at IFC National Marketing. And I have the pleasure of managing all sales for all product lines at IFC, which is Medicare and ACA, of course, but we also do a lot of group, and we do a lot in the life insurance, annuities, long-term care, disability space, as well as ancillary products, and a few other things mixed in there as well. So I get to manage the sales team, which is a phenomenal honor for me. And with me, I have a small cross-section of the team. We have a pretty large sales team. For their contact info, you can go to the QR links that are in this presentation. We've got a great landing page. You can also go to our website at ifcnationalmarketing.com to get their contact information. So please reach out to the team if there's anything that you need. We would love to hear from you. So I'm going to make some real quick introductions, and then we'll go from there. So to my left, we've got Don Teagues, who's our concierge director. Don will explain more about what he does, but his focus is to work with agents that don't want to do life insurance, long-term care, disability, annuities, products like that, or maybe you don't have the inclination or time to do it. So Don's a great partner on that front. We've got Audrey Villeneuve, who's on our Medicare and ACA side of things. She's got some counterparts throughout the country that do the same thing, and their role is to help agents market for best practices, for expanding your agency, recruiting, things like that. So they can help with anything on the business development side of things. And go to our website to get their contact info. Then we've got Naomi Buey. Naomi runs our health support team. If you haven't used them, know that they're there as a resource for you on the Medicare ACA side, as well as ancillary products, small group. They are a great resource for you. They're sort of the first stop before you call an insurance company. So they can help with anything from product compliance, marketing materials, all sorts of things. So give them a call if you need some help. And then last we have Gintis Garces. And Gintis wears a couple of hats. One, he's on the Medicare and ACA side in the Dakotas and Nebraska and Iowa. But he also has a ton of experience in the benefits side. And we think that's going to be a growth engine for us this year. It's been growing over the last number of years. We've got a lot of agents that really want to expand into the benefits side of things. And he's got a ton of experience there. And it's kind of really where he started. So we asked him to join us today on that front. So what we want to do today is really make sure you're aware of all of the resources, tools, technology, and products that you have access to. And the great thing about being affiliated with IFC is we do all the things you can see on the screen. But also you as an independent agent, as an independent broker that has a life insurance and a health insurance license, you have the ability to diversify your practice, and we can support you with all those things. So we're seeing a ton of demand from agents who are predominantly in Medicare and ACA that want to diversify their business. And you can see all the things that you have access to, things that you can do on that front. So make sure that you know that we're here to help you with all of those things. We've seen double-digit growth in a lot of areas, like ancillary, for instance, just took off last year, especially in the hospital indemnity side for obvious reasons. If you do decide to diversify your business, just know that you're not alone. I mean, we're here to either teach you how to fish or fish for you. We can do either one of those things, and we can do as much or as little as you need on that front. But if you're new to a particular product line, I suggest you keep it really simple. Like, you don't need to be necessarily a top to bottom expert in everything that you have access to, because you have a team to rely on. So don't worry so much about product technicalities. We'll help you with that. But if you want to get into life insurance as an example, final expense is really simple. Simplified issue, guaranteed issue, very short applications. It's easy to understand. Clients understand it. It's a very easy way to get into the life insurance business. And you can take it a step further and get into, dying too soon, living too long, or getting sick along the way, which is the 3 threats marketing process. And that's something that Don has done a lot of. We've got agents that are using that really successfully right now. On the long-term care side, if you're sitting in a Medicare meeting, of course, you got to stay within scope. But you can use that scope to tell people what Medicare doesn't cover. Long-term care is one of those things, right? So plant that seed and set up a meeting for a later date. So we're seeing a lot of Medicare agents getting more into the long-term care side of things. Of course, it's clients that are thinking about that. They know about it, but they're interested in it. So we can help you on that front as well. And then annuities. Annuities have really taken off. I mean, we've seen double-digit growth in that year over year for the last 5 years. And the industry expects to do at least $450 billion of annuity sales again this year. So there is demand for that. There's no question about it. There's some really easy strategies you can use. The first is just beat the bank. So if you look at CD rates, interest rates on savings accounts, fixed annuities are way more competitive than what you can get in a bank. So it's a really simple conversation, easy to do, easy process. And the other thing that we're seeing a lot of is income retirement. So giving somebody a guaranteed retirement, so ensuring their retirement. So income annuities is really kind of where we're seeing most of the annuity sales. And backing up for a second, on the life and annuity side, life insurance, Mike Maloney and Wade Hubers and his internal counterpart, they can help you with anything life, long-term care, disability related. On the annuity side, we've got Jen Wick and we have Sam Stenson. So find their contact info in the links that we provided in the presentation, or go to our website, reach out.
So if you do decide to diversify your business, we are here to help you with that. You are not alone. So we can either teach you how to fish, and you can do it yourself, or we can fish for you. And what I mean by that is we'll help you get confident, comfortable to go out and present a particular product type, get into a new market, or you can bring in our team to do it for you. So we do, like I said, a lot of training. You can ask if you want one-on-one training, we will do that for you. If you want group training, we do a lot of webinars. We're going to do some in-person training at our office in Coon Rapids. We've got our agent builder program, which we'll talk more about later. But take advantage of all that. Our carriers do a lot of training, and Integrity does a lot of training. So, and beyond that, we've got all of the marketing material, all of the support, the technology, and our gold experience that we'll touch on again later on in the presentation. But just know that you are not alone. We will help you with all of those things. I'm going to talk just a little bit about life and annuities because that's an easy product or products for you to transition to. And a lot of our best Medicare or best life and annuity agents are Medicare agents or ACA agents first and foremost. And they added that later on and make it part of their everyday discussions with their clients, and they've integrated into their marketing. So some of our top agents in those lines really started in the Medicare business. And the reality is, you as agents, if you have a book of business, you've got what every agent wants, which is prospects. So on the life insurance side, there's some really easy strategies you can see on the screen to get going. It doesn't have to be complicated. Again, you can keep it really simple. So final expense is a really easy one to get into. Simplified issue, guaranteed issue, that's really easy to sell, really easy to explain. And that's a really good first start. Beyond that, we've got, again, support and training for things like 3 threats. And that's something Don has done a lot of. He's done a lot of presentations on that. I know he's got some things coming up on that too, but it's an easy conversation about dying too soon, living too long, or getting sick along the way, right? It's a really easy message where you can use permanent life insurance to solve all of those issues. On the long-term care side, we're seeing a lot of that as well, especially on the asset-based side of things or hybrid products. You can use the scope of appointment to tell people what Medicare doesn't cover. It doesn't cover long-term care. Okay, you can't talk about it in that meeting, but you can plant the seed for a conversation in the future. And we're seeing agents do a ton of that as well. There's hybrid products. We've got some non-traditional products like True Freedom, which is not a true insurance product, but more of a subscription-based product. And then on the annuity front, annuities are in really high demand, and they are not complicated. They might sound complicated if you haven't done it. We expect, the industry expects at least $450 billion of annual annuity sales in 2026. They are in high demand, and that's an easy one to do. You can put rates up in your office. Call our annuity team. So Jen Wick and Sam Stenson, they'll get you annuity rates. You can put it on the board in your office. You can advertise in the local newspaper, send out a newsletter to your clients. It's easy to beat the bank. The way annuity rates work right now, you're going to beat the bank every time in terms of CDs, savings accounts, things like that. But the other side of things is guaranteeing a pension, guaranteeing somebody's retirement. So income annuities. That's where we're seeing a ton of play right now on the annuity side, and we can help you with all that. And to back up for a second, on the life insurance side, you got Mike Maloney and Wade Huber that can help you with all those things as well. So they'll get you trained, comfortable, confident, and get you ready to go out and sell life insurance and annuities. In the event that you don't want to do that, like you're uncomfortable, you don't have time, you don't want to learn the products, the process, then we've got our concierge team. And that's where Don Teagues comes in. So we've got to solve for that. So Don, if you would tell everybody what you do, how you work, and what your process looks like.
All right. Thank you so much, Aaron. So Don Teagues, concierge director, been in the business for about 20 years. And the first 8 years was sitting in your seat. I could take that, right?
There you go.
Thank you. Sitting in your seat, right? Sitting in your seat, belly to belly, face to face, client facing sales, right? The last 12 years, I've been in the FMO, IMO space where I was just doing exactly what I'm doing today, is helping agents get sales, whether it's life insurance, annuities, long-term care, across the finish line, right? So what is concierge, right? So concierge, so if life insurance, annuities, long-term care, if that's outside of your wheelhouse, right? Or if you're not comfortable with it, or simply you just don't have the time, then you have a dedicated person for you to help you with those sales, right? You just plug me in to where you see fit. And we'll do case designs together. We'll do client presentations together. We'll go on the apps together, right? And webinar support, webinar and workshop support. What Aaron was saying, we have the 3 threats to your retirement income. That's actually getting the phones to ring, right? So it's introducing those concepts to your clients. And just remember, you own the relationships, right? I'm just an extension of your office, right? I work for you. So why would you want to do this, right? Why does it matter? Well, your clients have unmet insurance needs. And those unmet insurance needs become opportunities for you to make money. You've built those relationships already, so that money is already sitting inside your book of business. It's already yours, right? It's already your money. We just have to go and get it. And, through it all, those people who actually concentrate and actively cross-sell their book of business will see an average of $150 per client in additional revenue. So if you have 100 clients, that's what? That's what, $15,000 worth of additional revenue? Throwing it to you. $15,000 of additional revenue. But if you have 1,000 clients, right, that's a lot of money. So what would that do for you and for your family's lifestyle? So what's next? How do we work together, right? So first of all, just give me a call. Let me know if you want to do it yourself, we do it together, or we do it for you, right? Because these 3 things will make you money, right? Not doing it won't make you money, right? So just give us a call and we'll mine your book of business. We'll possibly do one of those webinars and we'll get the phones to ring. And just remember, once that happens, then we're off to the races and you're ready to make that extra money. And again, you own the relationships. I'm just an extension of your office and we'll make money together. Thank you. And I'm going to hand it off to Audrey.
Yeah. Hello, everyone. Thank you so much for being here today and tuning in to check out some of the knowledge that we're trying to impart on you. It's been a very unique year this last year, I would say, for lack of a better term. So let's focus on where we can find the wins this next year. Get comfortable with Medicare supplements. We heard a little bit of that from our carrier panel here earlier. Also, we have some new Integrity proprietary products available. There's even a MedSup one available in Minnesota. So please reach out to me if you're interested in learning more about that. We also need to look at some new ACA alternatives. That was a pretty big disruption this year as well. So we need to get some strategies together to look both at hospital indemnity, dental vision, and also how to handle our Part D to supplement some of that lost income this year. Talking about some more marketing-minded stuff, let's go into a little video on my favorite marketing program that we have here, the Gold Experience.
The Gold Experience is a proprietary omni-channel marketing program from IFC that is designed to help you as an independent insurance agent or financial advisor protect your book of business, attract new clients, and make the future you dream of for yourself and your business a reality. Your clients are buying a variety of protection products, so why not give them the option to buy from you? Unfortunately, there are limited hours in a day, and most agents and agencies don't have the hours or manpower to maximize all the potential in their book of business. The good news, you ask? IFC and the Gold Experience is here to help. We've created a robust library of done-for-you email marketing campaigns and a library of social media content and downloadable print materials to make marketing and cross-selling a snap. If you don't have the time to learn and cross-sell other products, IFC has a solution for you. Our concierge team will partner with you to handle everything for you on a commission split basis. You maintain the client relationships because our experts act as an extension of your office. Remember, if you don't take control of the information and sales on these opportunities, then you're effectively letting the fox into your henhouse.
So please reach out if that's something you'd like to learn more about. I'd be happy to get on a demo and show you some of my favorite features of it. All right, so some of the other stuff I would like to discuss is some of our world-class tech packages that we can bring to you. We have Integrity Connect, which can work as your one-stop shop as a Medicare agent, and I know Naomi's going to talk a little bit more about some updates on that here in a sec. Then also just want to kind of tell you guys a little bit more about some of our lead programs. We have those available online, in person, mailers, bulletin boards. We can do commercials, radio ads, you name it, all across the board. Here are some examples of some of the pre-canned content that we have available to you. Again, completely customizable. Business cards, T65 postcards. We're really going to have to focus on those this year because those are one of our whole products still, right? So let's nail those T65 leads. We have a ton of different avenues that I'd love to help you out explore those with. Along with some of our other services that we offer, we have some very phenomenal strategic partnerships. We have some stuff on the social media side with Sandra Gebhardt. We have a virtual vault that can hold your will, grandma's recipes, family stories, all that with Legacy Safeguard. We have security coverage for you with CyberFin. RSSA is a new program that's awesome. I know Gintis is going to talk about a new lead program for group, which is fantastic. But my favorite one that I love promoting is Leading Response. So Leading Response quite literally compliantly puts seats in your room to give a Medicare presentation to. And this is compliant, and we've seen success rates with this from either 30 to 80% writing power within that room. So please reach out to me. If I was an agent, this is all I would do. We also still have Agent Builder available. So let's say you're going to kick some ass this year and continue to grow your book, and now you're at the point where you have too much capacity. We need to build a downline for you. Agent Builder is exactly the tool that you can use to do that. Not only will we help you kind of source someone to fill that seat for you if you don't already have someone in mind, but my brother and I, and along with the rest of our IFC staff, we will train that agent from a green bean to a well-seasoned agent within just a few weeks. So lots of different touches. We have that in person and virtual, tons of different hybrid options available as well. Please reach out to myself or Frankie if you'd like to learn more. All right, Naomi.
My turn.
It is your
Yay,
turn.
I get the power. Yay, all in this little button here. Okay, so I'm here to talk about some ancillary products and some other things that are going on. No, your eyes are not going bad. Yes, this is little, but that's what that nice little QR code is there. Scan it. Then you can see the full version. Or you can reach out to the health team and we will be able to help you get that. These are some of the options that agents have reached out and said, hey, can I get a cheat sheet for that? This is great, and look at the graphics on that. So again, if you want to see a bigger version right away, click on that QR code. Otherwise, just reach out to the health team and we'll send you a copy. Yep, eyes, they're still good. This is another dental and vision cheat sheet. It looks tiny, but I promise you, if you click on that QR code or reach out to the health team, we will get you a normal sized version and that you'll be able to see. But again, these are options that we are hearing that our agents are asking for. Let us know. We can create these for you. And it's not just for Minnesota, it's for the other states as well. Okie doke. So now let's talk about some other things. Ancillary uptick. We talked about that a little bit about the cross-selling. We saw a huge uptick just since our last live webinar that we did in September. 200+%. I mean, wow, that is great. You guys were looking for other options to increase your commissions. That was it. That was what you wanted to do. Dominating on the hospital indemnity side, and actually some of the ancillary products, is Manhattan Life. They are making a huge presence. Please, please reach out. They don't have as many things in Minnesota quite yet. We know how it is to get contracted or licensed with new products here in Minnesota, but they are all over in the other states. MedSup House Rule number 4, open enrollment coming August 2026. No, it will not be effective August 1st, 2026. That is just when it's coming to be official. It's going to be during the same open enrollment period as AEP. And with that, you will have the ages between 65 and 70. And there's going to be penalized. The members are going to be penalized 15% in 2026, up to 35% in 2029. So please, please, if you're putting members on these that special MedSup open enrollment, can they afford it? Why are they going on it? Because there's other options, like we talked about earlier. There's the copay plan. There's the high deductible. So there's different options for you. So please be aware of that. Integrity Connect updates. You guys are wondering, what's Integrity Connect? Well, it was formerly known as Medicare Center. I still call it Medicare Center. It will always be Medicare Center to me. Audrey, you still call it Medicare Center too? Yeah.
Connect.
Yeah, Connect. So there's some things that are coming. There's agent and agency view. So you'll be able to toggle back and forth to see the agents that are underneath your agency. We've seen some where they can't see everybody yet, but that is coming. You will slowly be able to see more and more of that. Retire Flow. Retire Flow is a really great option as well, a new thing that's coming. How are you going to find out more about that? We're going to be doing some webinars, but you can also reach out to the health team. The View As option. This is an option that you can assign somebody else to view as you. You're giving them permission to do that. Just be careful of who you're assigning that to. Another thing that's coming, MedSup quoting, is going to be on the Medicare Center side of the Integrity Connect umbrella. You won't have to go to CSG just to connect with a MedSup. And in the Integrity Connect, there's also additional benefits. And you'll see a slide coming up of what some of those options are for you. Save your sanity. Ask IFC. Use IFC. We're committed to making your life easier, not harder. Reach out to us. Call us. Email us. Ask us those questions, but also celebrate those wins. Just don't call when you need something. Call or email us when you have something to celebrate. We want to hear about those as well. We want to share that with you. You guys are part of our family. We like to celebrate with our family. And you all know, at IFC, we like to have a good time. Okie doke, next slide. Oh, look, some of those benefit options for you. AT&T, Staples, VRBO, Enterprise Rental, Amazon, Delta. Who wants to fly somewhere tropical? I do. Oh, wait, I was just there. And then this is my team. And so when you reach out, this is the health team. When you reach out, this is who you're going to be talking to. And we have roadshows coming up. please, please sign up for your road shows. First one starts March 3rd. That's in St. Cloud. And we have Sam Richter, who's going to be there. He'll be there in person. Some will be in video. Do not want to miss out. And now it's on to Gintis. Can you handle the power?
Oh my goodness. I think
It's
I
a
can.
lot.
I hope so.
It's a lot. Okay.
Thank you.
Yeah.
Thank you, Naomi.
Yeah.
So my name is Gintis Garces, and I really wanted to spend a moment today to talk to you guys about an opportunity for a really good win in the benefits space. Now, traditionally, the benefits market has really been somewhat of an underserved market in different areas. And it is a great market that, even though it's competitive, the reality is that it can be very reachable for success for an agent when they're provided with the right resources. And what that will do for you as an agent is it'll create great opportunities for cross-selling other lines, as well as leading to greater diversification and stability within your block of business. Now, about 6 months ago, we started really digging into our current benefit offering and putting a lot of energy and effort to try to make sure that we're offering the right package and products for you. And what we did is we went out, we pulled different agents, we evaluated all of our carrier contracts, and we compared everything that we had for tools and technology versus what the agents said they really felt like they needed in order to level the playing field. And what we found is that there are several areas where agents really felt like they needed help. Things like quoting and enrollment tools, quoting support, different forms of technology in terms of compliance documents, as well as renewal analysis, unique products, even things like lead sources, as well as marketing support and systems. And I'm really, really happy today to be able to tell you that we actually are very excited about a few things that we have coming down the road that are really going to help move the needle for you as an agent working in the benefit space. One of the things that we started with is we did a little bit of restructuring of our already great group team. We did bring over Troy Stenzel from the health team, and we have Todd Stead as well, obviously still there, as well as Michael Olthop helping out with concierge. In addition to that, we have some great subject matter experts in Ian Ross, who is an ICRA expert from his former life, as well as Zena, who is also a small group expert as well, that are going to be supporting us on the health team. From there, we also begin to look at different marketing programs. Audrey already talked about the Gold Experience. That's actually a really great product for the group side. As a matter of fact, it can help you market to your current clients, cross-sell, increase that revenue from there. But in addition to that, you can also use it in conjunction with other tools to also drip and create a better opportunity to get in front of new group clients. We also are bringing in new lead sources like Judy Diamond that can bring you 5,500 filings and other ways to get in touch with group carriers. And then to help you close the deal, we've brought in great tools from Sam Richter and AI tools that'll actually help you evaluate the business you're selling to and give you a strategy to help have a better opportunity to close that new business and bring them over to your book. Now, in addition to that, we've formed some very big strategic partnerships. Some of those include things like MedSurity, where you'll be able to save on compliance documents and other TPA support, as well as Anuvi, which will be able to support you in COBRA administration. We're also going to spend time regularly evaluating our products to make sure that we can bring the most cutting edge products that can bring value to your clients, to give you an opportunity to be unique in the marketplace and have a good story to tell, which we all know as benefit brokers that it's very relationship driven and the story you tell is very important. Now, some of those partnerships that we're bringing in are going to include things like our new level funded carrier that also has an ACA alternative. That carrier is a nationwide carrier. It's missing in 5 states, unfortunately not in Minnesota, North Dakota, and South Dakota. But if you're outside of that market, you have a real unique opportunity to bring a unique level funding product to your client that has some very, very cool features. Now, in addition to that, we've also been spending time evaluating different PEO relationships and other unique carriers such as individual MEC providers and such, as well as new ancillary carriers. So we're really hopeful that with all of the different new tools, technology, and packages that we're going to be bringing, that we have an opportunity again to create that great win for you. Now, that might create the issue of staffing. The great news is, or maybe you don't have the experience in the benefit space, The Agent Builder program does also include a whole segment on the benefits package, which is an absolute great tool. We've actually had several agents go through it, and it's been extremely helpful in getting them off their feet and getting them up and running. So with all of that, we really look forward to the opportunity to partner with you and do more group benefits. And I'm going to go ahead and pass it to Aaron Niedorf.
Aaron, before he passes it off, Gintis, you talked about Sam Richter. Where, again, can you hear more about Sam Richter and all of his awesome things?
Besides our agent roadshows?
Our agent roadshows, yes, yes.
I'll take agent roadshows for $500.
Yeah, there you go.
So I'm really excited to have our agent panel here today. You know, when we do conferences and when I've been at conferences in the past, we always want to hear from our peers, and we always get really good feedback from our agents. And we were talking earlier as a group how it's so awesome that our IFC agents are open and willing to share ideas. And so that's what we want to do today. And we heard from, you know, some of the speakers earlier today that it's really early to be here right now. So we don't know what commissions are going to look like. We don't know what products are going to look like. But we do need to figure out, you know, how we're going to find the wins and how we're going to react, adapt, and overcome to the situation that we find ourselves in. We, of course, have challenges if you're in the Medicare and ACA business, and really being in the insurance business, period, can be difficult. And you always have to seem like we always have to overcome some things. So I'm really excited to have the agents that we have with us today. And I'm just going to make some quick introductions here. So we've got Bob Denke with us from South St. Paul. Bob is the owner of Denke Insurance Services, and last year, 24-25, was inducted into the marquee Who's Who in America. So congrats on that, Bob. That's fantastic to hear. So Bob's been at it for about 30 years. He's got a great team out of South St. Paul. He's got an office in St. Louis Park as well, focusing predominantly on Medicare and ACA products, but also has done some other things beyond that in partnering with IFC. Next, we have Julie Haggerty from Hastings, Haggerty Insurance and Financial Services. Julie started as a captive agent and then went independent in 2008, if I have that right. 2008, and has a really significant book in the Medicare and ACA business, as does everybody else on this panel, but also does a lot in the property and casualty market, and does a little bit in the group side, and sort of a diverse practice here and there. You've touched a little bit of everything, it seems like. And we also have Sarah Schmidt from Owatonna. Sarah she's been in the business for 30 years. And opened an independent agency in 2009, so I've owned your own agency for quite a while. Again, in the property casualty side of things, significant business on that front, but Sarah also is in the insurance, or the Medicare ACA side of things, and does life insurance and other products as well. And then lastly, we have Mitch Anderson. Mitch is with Rochester Senior Solutions and Primetime Health. As it says on your shirt there. It's a good way for me to remember. And Mitch has a great team out of Rochester, also a satellite office in Spring Valley and a new office in Elk River as well. Again, big in the Medicare side, some ACA, I know some of your agents are doing group, and Mitch also has incorporated life insurance and annuities into his practice as well. So with that, you know, we mentioned earlier, it's really early. Like, nobody knows exactly what 2026 is going to look like, or 2027. So what I want to maybe start with is, you know, what is, as agency owners in different areas, what is your biggest focus for 2026? And it's kind of a big question, but where are you going to find the wins? Is it focused, you know, still on Medicare and T65? Is it ACA? Is it the P&C? Is it other things? So just curious, as experienced agents, how you're going to react to the market that we've been kind of forced into. And Bob, we'll just start with you and maybe go down the line.
Well, thank you, Aaron. I think the biggest thing, you know, with our practice is we have such a predominantly Medicare book. And so we're going to continue to do that, turning 65, those coming off of employer coverage, things like that. Our ACA, or the Affordable Care Act, insure, whatever you want to call it, you know, we have a pretty sizable book there too. So, and then really kind of do that. And we're also, as part of our practice now, working with Don, who we, you know, was on earlier on the concierge. So we're doing that. We've got a series coming up of 6 different things that we're talking about for financial stuff to help out my clients, and obviously inviting new ones.
Mm-hmm. That's great to hear. I'm glad to hear you're working with Don, by the way. I know we talked last week. You've already got 18, 20 people, I think, registered for a seminar that's coming up.
Yep.
So that's fantastic. So glad to hear that. Julie, same question. How about you?
I think this year we're going to start focusing on looking at our expenses, becoming more efficient, trying to get more out of our day. Diversification is very important. So in my office, we divide up responsibilities, and by working together and having office meetings, we share the knowledge that each of us has to have everyone improve and help. We try to build a real diversified clientele.
Okay. Sarah?
Yeah. So I think the crossword for us this year is cross-sell. So if they have health insurance, we're going to talk about life insurance. If they have, auto and home insurance, like we want to bring them on to our health insurance. So it's just the relationships we already have with our clients, just offering them more.
Right. So you've got what every agent wants, right? With prospects in your own book for everything else that you do, right? That's
Very
kind of the
grateful for
concept,
them.
right? All right. Mitch, how about you?
Generally, the focus in my business has been on the T65 on the Medicare side. We're going to continue to focus on that with seminars and things, but we're going to stretch the line a little bit on our ACA business. We're working on an outreach program to try and cross-sell accident, cancer, those type of ancillary policies, especially as the deductibles and maximum out-of-pockets are ballooning on the ACA, and then on the small group side, we have a few small groups, but we're working with Todd Stead to kind of get a little more well-versed on ICRA, level-funded plans, things like that, to make sure that we maintain a good status on the group side. Also have a good internal concierge type team that I work with on life and annuities, and we're going to continue with that as well.
Yep. All right. Fantastic. So, as we talk to agents, we've got thousands of agents all over. Upper Midwest, we're large, but nationwide we have agents all over the place, and all of their businesses are a little bit different. It's kind of interesting. We get a good perspective on how all these agents work. Some are in the P&C business, some are financial advisors, small group, Medicare, ACA, and they all market differently too. So curious what your most effective marketing methodologies are, and they're varied all over. We have some agents that don't market at all. They just work on referrals, and others pour literally 6 figures of their own money into marketing. Some are going so far as to do TV and radio and other things. So curious what the most effective marketing plans for you has been, for those that are listening that are trying to build a presence in take advantage of the opportunities that are out there. Love for them to hear how you've grown your businesses and practice and what's most effective. So Bob, for you, what's the biggest focus in terms of marketing?
So I guess, I look at it in several ways. Marketing doesn't necessarily mean money.
Mm-hmm.
So you can definitely get out there, join some organizations, just get your face, in your market. So that's one of the things that I did early on, and that we're going to put a lot more emphasis on now. But still, referrals. That's still my biggest part of my practice. I probably get a handful every week of people just turning 65 or need help or whatever it might be. I think for me personally, I think that's where we're going to kind of stay focused, is kind of our sphere of influence, people in our community, and just try to keep building on that. And again, like I said, it doesn't have to always be about money.
Yeah. So curious on the referral side, and that's something as agents, if you're a captive agent, you were taught early on how to ask for referrals, and it can be a little bit of some art, some science. Are you proactive about it, or does it just comes naturally, or are you asking clients for referrals?
It's a little of both of those. It's pretty organic, because when I started in the business, we just got a handful of names and said, hey, go call these people, and we called it dialing for dollars back in the day. And every one of us here has probably done some form of or fashion of that. So for me, referrals has always been a part of my practice. And so it really hasn't been something I've had to focus on, because it's just part of what we do. When we send out letters, things like that, and even in meetings, those are the things that I focus on even when we're sitting down with clients.
Got it. Okay. So Julie, what's your most effective marketing strategy, and where do you where would you focus your time, energy, and money?
I have found that the best marketing, the best advertising is word of mouth. And definitely in the clients that we all work with, there's that water cooler talk, they all share. So if you are doing this for the right reason and you're doing it for the client, and you're considerate of them and their needs, and you put that first above your own expenses, your own income, it'll follow itself. And I do very little advertising. I never asked for a referral. I've had people just come to me saying, hey, so-and-so told me to come see you. You're the person to see. And the golden rule.
Yeah,
it's key.
which obviously is customer support and treating them well and doing the right thing. And
Treating them
just,
how you would want to
yeah,
be treated.
Absolutely, absolutely.
Yeah.
Sarah?
Yeah, I mean, we've done a lot of different marketing things throughout the years. And you ask what changed. With all the changes that we had this last year, and not sure if I'm going to have the same money to work with from a marketing budget, I kind of stopped doing generic advertising just out to the masses and made it more focused, direct. I went into the State Farm agents, the American Family agents, the Edward Jones, handed them my flyer and like, hey, I'm doing these Medicare meetings, one-on-one, like inviting them to come on a much more personal, like working with the center of influences, whether it's or mortgage brokers.
Definitely.
And like the client referrals, like you have earned those. You have given and given and given to your customers. No wonder they're referring you. Like you have earned those referrals business. I have no problem asking for referrals from my clients because I know I have earned that. Like I will work hard for you. I will find this out for you. We will call the pharmacy together for you if we have to. Like the referrals are what you have earned by being an amazing agent for these people.
Yeah, I love how you put that too, that you've earned it. So many people are afraid to ask for referrals. Like they've got a hesitation or a fear of that. And if you're a good agent, you do everything you just said, I think you have earned it, and I think clients are happy to do it.
We have this approach that we're using this year. It's called give, ask. You are giving information. We are giving out resources. Ask for the referral that you've earned. Give, ask.
I like that a lot.
Yeah, really good. I love that. Mitch, how about you?
It's hard to top that. That was pretty good. The vast majority of the leads that I get are referral based from other clients. I have good working relationships with financial advisors in town, and I get a lot of referrals from financial advisors. I do have a fair amount of spend on different types of media, social media, digital media, print media, things like that. Not I wouldn't say a crazy amount, but enough. I found that if I'm getting my name out there several different times, even if somebody's sister says, go talk to Mitch, if they see one other piece with our name on it, that's a little more validation. For this year, what I'm kind of doing is I'm hoping not to cut my marketing budget. We'll see, as things go through, but I'm trying to be a little more tactical and put my spend where I see results rather than just kind of shotgun spend where I've done in the past, and kind of drill it down a little bit into what works rather than throwing it out there.
Yep. So yeah, we're hearing that a lot because agents want to be really mindful with their resources, of course, and we always try to leverage carriers where we can. Sometimes you can lean on carriers for marketing dollars. And if, for those agents that want to grow and that are really invested in that, raise your hand and call us to call our sales team, call me. We've got a lot of, I think, ideas that we can share with you in terms of, ways to get, to maximize your resources, your time, your energy, your money. For newer agents that maybe don't, you all have established practices, you've been at it for a long time, and we have some agents that are making a career move and they're new to the business, or they're younger folks that are, it's maybe their first career, and they're not coming up through a captive channel, which a lot of us did, right? You get a ton of training and learn a lot of things that you should do and maybe a few things you shouldn't do as a captive agent, and you kind of learn from that and you go independent. But we're seeing some agents buy leads. So we do have some lead systems that work pretty well. I don't know that any of you are buying necessarily leads like internet leads or social media leads that I'm aware of. Or, Bob, have you been doing that with, you've got some newer agents. Are you doing any of that?
We did some early on, but again, if you don't get the right ones, like always, you spend a lot of money and don't get a lot of results.
Yep. Yeah, but we can help you with that. We've got some really good lead vendors that do work pretty well, that we've vetted, that we know if you do what you're supposed to do and the follow through and all of that, that you can have conversion rates and make money on that and not be afraid to spend a little money on those leads. So we do have some pretty good lead vendors, and we've tested 1 million of them. Some of them, I would say the majority, are okay. If you're willing to do the work, though, you'll find some diamonds in the rough for sure. And you can go to Integrity's Connect platform, then Lead Center, and buy leads there. We also have some really good vendors who can help with that. Centers of influence, I think, has been mentioned a couple of times. For newer agents, I always suggest go make friends with some financial advisors that are not in the insurance business. You have to be mindful there because they might be doing life and annuity, so be careful of not stepping on toes there. But see that a lot, CPAs, P&C firms. So there's plenty of opportunity to get out in the community that you're in. And I think, see, you're all shaking your heads. I mean, those are really good lead sources. In my old life, I worked for a big financial services firm, and it was 100% referrals for Medicare clients from financial advisors. We didn't do any advertising and built a book of thousands of clients just through that. So I would suggest everybody do that. We have a lot of agents doing more social media. We've got some agents, like I said, are doing some radio. And I've been interviewed on a few of those. That's been fun. And a couple even that do TV. So, but that's not for everybody, and that's obviously very expensive. I want to talk a little bit about seminars, because I know some of you are doing seminars. We have had a ton of success in that world, in Minnesota and nationally. So we use a vendor called Leading Response. We get a pretty significant discount because of the volume that we do. And the conversion rates have been great. If you are comfortable doing seminars, and especially if you're in a populated area, it's hard to do in small towns and rural towns, but in a bigger metro area or bigger cities, there's enough of a population that they can drive a lot of folks to that. And you don't have to use Leading Response. A lot of agents do it themselves. They do their own marketing, their own advertising. But what Leading Response can do is help. They take care of all the logistical stuff. They take care of they know all the compliance rules. They get people in seats. All you have to do as the agent is know the material and learn how to convert, which is the biggest thing. How do you turn those prospects into clients? And I know, Bob, you've done some of that. Mitch, I know you have. And I'm not sure about Julie and Sarah, but Bob, if you wouldn't mind, what has been your experience with seminars, kind of in general?
Well, seminars, I think, are a great way. In my previous life, kind of what you're saying, that's how I did most of my business, was doing seminars. So I think part of it is you got to be, you got to want to do those seminars. If you go in there and you don't feel comfortable being in front of people, talking in front of groups, I think it can be a little tough to do those. But I think once you kind of get those down, the Leading Response, we've had great success. I think we've averaged, 18 to 25 at most of our meetings. We did a lot last year, and obviously our numbers went up. We've done some where we just did the T65, and then we were just emailing them and giving a location, things like that. We didn't get as many, but then when you look at your cost, so sometimes that's part of it, is how much do you want to spend? Going back to what was said earlier, is, do you have the revenue, or do you have the means to spend the money? Because there is an upfront cost with Leading Response or any of these other carriers, versus just sending emails out, either whether it's to your book or buying T65 leads. I think it really depends on what do you want to do and how big of a group can you accommodate.
Mm-hmm.
So,
and what's your conversion rate been on those?
Probably close to 80% of the people who attend. I mean, it's kind of crazy, because they're coming there typically because they want that knowledge. And if you can prove to them that you have the knowledge and the ability, and that it doesn't cost them anything, and then you're a true professional, kind of what we were saying all earlier, is, we're not just one-trick ponies where we only do one thing. We really want to help our clients. And as Julie pointed out, when they see that you care, when they see that you want to help them, and there's no hidden agenda, then I think they're more apt to do business with you.
Mm-hmm. Yeah, it's the Zig Ziglar thing, right? Nobody cares how much you know until they know how much you care.
That's exactly
what that is. So, if your conversion rates are that high, you get that many people. And have you ever lost money on a seminar? Like
Not really, no.
At minimum, I think if you're doing an okay job, you're going to break even.
Yeah,
And
at
you
a
should make
minimum.
money first year. Obviously, you got the renewals beyond that. So I would suggest seminars for those that really want to grow and are comfortable with it.
Mhm.
Julie, have you done any seminar marketing?
No, I excel better on the one-to-one
Yep.
interviewing and talking with my client, where I have found, and they're very useful during open enrollment, logistically and just with the chaos that we've all been through. I think it's going to be more and more effective for me to communicate with my insureds during open enrollment about changes and things like that. It also kind of puts the onus on them of, you know, you need to come either see us or come to this. So it's a little more convenient or gives them more opportunities. But then we do a sort down of our clients, so we don't just open it up and have everybody come in. We narrow down the focus and focus on a certain company or for a certain type of product, or hey, if you're leaning towards converting between the gap and the advantage plan, this is the seminar you should come to. So we're finding that that's very beneficial.
Yep. Sarah?
Yeah. This is something I just started doing in the last couple of years, probably from going to an IFC meeting and saying how like profitable the seminars have been. I don't call them seminars, they're just community meetings. And I've done different things. Like I started out at like my public library because they had a room, and put posters up at Pizza Ranch and at the library and any place that would let me stick up a poster. I didn't have a lot of people show up because they saw my cool poster. But when I walked it into the dentist office and when I took it into my accountant's office and all the tax places, said, hey, if you know anybody that's struggling with their taxes in the ACA, I'm going to be having a meeting about that. And I've done strictly just Medicare meetings, but what we've kind of morphed it into is we now call it our Ready to Retire meeting. So we kind of talk through the process of like, hey, if you want to come to one of our community meetings and just talk about the process of retiring, maybe you're like, I don't want to wait till I'm 65. I want to talk about this at 60, and I might need some MNsure, like gap coverage, but my spouse might be older. Or maybe you're 65 and everybody's telling you there's a penalty if you don't sign up. So we're just going to talk through like what you need when you retire. Health insurance being the biggie, but what about that 401k you're going to leave at your job? Maybe you only had group life insurance and health insurance. And so kind of with my give, ask thing, in our Ready to Retire seminar, we kind of have this whole process where they're going to walk out with a tote bag, probably a UCare tote bag, of stuff. But we're going to be giving them resources. After I explain what Medicare is, I give them a little Medicare booklet. After I explain what MNsure is, I give them a brochure about MNsure. Like, we're giving resources constantly. Talk about life insurance, give them a brochure on that. Touch on long-term care. So like they kind of walk out of here with this, all these tools about what do I need to know ready to retire. These are not huge meetings. Like I 10 or 15 people at a time, but like the quality of that has been really good. Anytime we do anything marketing, we have to sit down and have a meeting afterwards. Like my first one at the library, when I spent all this money doing all these brochures and like hardly anybody comes, sit down and I write down what worked really well about that marketing event. Not much. What didn't, write down these ideas. So every time after I do marketing, like our Ready to Retire meeting has been a series of a lot of things that didn't go right before we kind of got it to how we like it for Ready to Retire. And then after we do it, we're still gonna, what can I improve? What can we do different next time and keep them moving? But the number one thing to have a successful seminar, snacks. Good snacks.
Under $15 though.
Yes.
Right? Under $15.
We bought a popcorn machine during open enrollment, so most of our snacks are popcorn.
I like that. Yeah. And I love how diverse your presentation is too, but you're kind of touching all of those things. So they know what you do, right? You just tell people what you do, and when they need that, whatever that solution is, they know who to call.
Yep. And make it very, very clear that nothing's for sale.
Yeah.
There's absolutely nothing for sale tonight, so don't bring your checkbook.
Yeah, that's great. Just there to learn, get
Yep.
some information. Love it. Mitch,
Yep.
how about you?
Very similar to what everybody else said. I've done a number of seminars, and I've had good luck with leading response for getting good quality people in the seats for the seminars. What I would kind of say is kind of the key. A couple of different keys. One is you don't have to spend a lot of money for the seminar. Snacks are good, but you don't have to have a big meal. Keeping it under $15. But it doesn't have to be a fancy venue. People are, if you have easy access, comfy chairs, a table, a notepad for people to take notes, and a coffee and a snack. That's what you need, because people are there to learn the content, not necessarily have a date night or something like that, right? And so you don't have to spend a lot of money on the venue if you're doing a presentation. So that seems to work well for me. Just kind of keep it simple, keep it focused. Julie, I think you're kind of on the money with during AEP. If there's any positive to whittling down the number of options that we have on the Medicare side, it's that it makes a group presentation during AEP or pre-AEP much more simple and streamlined.
So maybe switching gears a little bit to technology and systems and platforms, right? Some agents, especially solo practitioners, they're working on paper. They still have paper files, and that's a way to run a business. But we've got all this technology around us now to make us more efficient. From a CRM standpoint and from a marketing standpoint, you heard earlier that we've got our Gold Experience, which we launched last year. If you've been to any IFC event, we've probably mentioned it 7,000 times.
Yes.
But so we have promoted the heck out of it. And there's other platforms out there too. But the reason, of course, that we launched it is a couple of reasons. One is to be effective communicators with your existing clients, which it sounds like you all do, especially when you have plan changes and other things, but to talk about, client events and cross-selling, diversification, and things like that. But it can also be used to market to prospects, whether it's email, mail, social media, that kind of thing, to help. What doesn't matter what product it is, whether it's Medicare, or life insurance, annuities, retirement planning, whatever it is. Are you guys all using technology, or any of you using Gold Experience or some other platform, and how effective has it been for you? So, Bob.
Well, I got signed up for the Gold Experience right away. Todd kind of told me I had to, and so I went ahead and did that. He's got a really easy way of telling you what you need to do, and so I did that. I didn't use it a lot. I had hired a marketing person to come help me, and so we were doing a lot of it through them. And then when we saw the changes and the cuts coming, that was one of the cuts that I had to make just to keep my costs down. So I let that person go. And then I went back in a couple weeks ago into the Gold Experience, and I was really surprised at the number of things that are in there from when I first looked at it, last year and a half, whatever it's been. And so we actually sent out a thing for President's Day and for Valentine's Day just to make sure that we kind of got the process down. We've got another one coming out for our seminars. So I think the Gold Experience is really going to be a big one for us, as far as the technology part goes. We've also used Medicare Center and, some of those things now. I think it's called Integrity Center. I learned that last week that the name has changed. But I just think there's so many tools that IFC gives us that, and in the past I haven't used a lot of those. Kind of stuck in my ways, that old man thing. This been working for me for years. Why change? And so I think I just need to do more of that. Get on the shtick and take advantage of some of the things that IFC offers, because it's out there. It's just a matter of just doing it.
Yeah, so I'm glad you mentioned that you went in a couple weeks ago. You saw this material, so that the library of content that our marketing team put together is massive. I mean, it's huge, and it continues to grow. So I'm glad you mentioned that. It reminded me. So, Julie, what kind of platforms, technology do you use on the CRM side and the marketing side?
Well, I think that's part of our goals this year, is to really look into technology. It's always been something that I hoped for. I hate technology. My staff will sit there and laugh at this, but my goal has always been to have the keypad like the bank, where you could just have them sign right there and it's all downloaded in. So I want to investigate, and that's where I'm going to invest so that we become more efficient. In the past, I haven't done it because I haven't had the time or energy to devote to it. But Sarah said it perfectly earlier when she mentioned, like on the Gold Experience, you'll get out of it what you put into it. So that's our goal this year.
Yep. All right. Sarah?
Yeah. So I did start with the IFC Gold Experience, and honestly, it was a little rough to get started. But when you talk about you get what you put in, I reached out to IFC, and the people were awesome. They got a team of people to start helping me, why is it rough? What is going on with it? Well, what do you think it should do? And we're just really able to help me make some customized pieces of what I wanted it to do. Am I all the way there yet? Absolutely not. I've got a lot to learn and a lot to do. But like the difference of you can buy a marketing platform any place, but it doesn't always come with a team of people who are ready to just step in and set up a Zoom call with 5 experts to figure out what's going on. So.
Yeah, no doubt. Mitch, how about you?
I think the gold experience has been really good. I kind of with these guys where I was in on the ground floor and it was a little shaky. I won't say shaky. I take that back. It was not what I was hoping for, right? I was hoping for something absolutely fantastic. And it's really turning into that now over the course of time. It costs so much to build a marketing program from scratch, but it's there with the gold experience. I can just log in and put together a campaign. It's simple. IFC people are really easy to work with, accommodating, willing to put anything together. It's just a fantastic way to get the message out. And I use it for birthday messages, holiday messages, and I'm absolutely surprised how many responses I get back from my clients that say, thank you, I appreciate the happy birthday note, or, happy Valentine's Day to you and your family too. I mean, it's really much more interactive than I thought it was going to be. And so I'm really a big fan of the gold experience, for sure.
Yeah, that's good to hear. Thank you for sharing that. I appreciate it. And we're kind of running out of time here. So we can't dive into as much as we probably could. I mean, we could spend a whole day just talking about what everybody does and what works and what doesn't. And really, we didn't have time to get into AI either. A few agents were together last week, and AI is changing the game. And at our road shows, we're going to have an AI presenter as well. So if you get a chance to get to our road shows, but that's going to change the world too. It already is, right? We have some agents that have incorporated it, and we'll get more resources out on that too. But thank you for sharing your thoughts, your ideas. What we talked about earlier before we started this, that our agents are so willing to share what's going on and help each other, because we're all sort of in the same boat. We've got a market that's really tough to navigate through, and so I think it's good for people to hear things that maybe they're already doing or picking up some ideas from you guys and what works and what doesn't. So thank you all for taking the time and energy to come spend some time with us, and
Thanks,
appreciate that.
Thank you. Thank you.
Oh, hell, I was watching the show. One of the other cool benefits that we didn't mention to you is 50% off of Cinemark and AMC theaters on prices of tickets and stuff. I thought that was pretty cool. One of the other things that we really want to thank everybody for spending a day with us. I know we had a couple technical difficulties, but we got through it. I want to kind of wrap up some of today's findings that we had. We started with some of the carriers. Alina has increased because of you guys, almost 2 times the amount of clients that they have. Again, they stayed in the metro market for us. They're a very good partner. Please work with them. Medica has stepped up a bunch of different ways, and I know some of you have rode the roller coaster with Medica as well as Blue Cross. But they're talking about a lot of app pressure because of what they did with the UCare. I think we've learned we're going to have a bigger core benefits focused, and that's kind of one of those no shit. You can't give away free stuff and then worry about how much your ratings or how much things cost. So we're going to get some clearer things. I know that the carriers talked a little bit doomy gloomy on the CMS reimbursement rate that's at about 0.9%. I'll have a podcast coming out after this airs with Ryan Kimball, and Ryan Kimball believes that that's probably going to end up after the kind of the fallout and the counter negotiations. It's probably going to land in that 3% range. 3% really is kind of where the commission load sits. If we look at about $1,200 a month today on the reimbursement rate monthly, that'd be about $36. That's renewal rates. That's kind of the commission load. So that would be really good to see. Maybe a little precursor to why some of those commissions might come back that they were talking about. And that the other thing Ryan talked about that I believe Brad touched on is that the new billing practices that are going to be asked is going to be simplified down to, I believe, 10 different billing objectives when it comes from network to the insurance companies. I may be oversimplifying that, but he was very excited about what that would do and kind of prevent some of the fraud issues. So we talked about that the collaboration between new MAs and companies that are starting to look into Minnesota is starting to happen. We actually have a call next Friday, a new MA that's looking to come into Minnesota. And you would think you'd avoid this market, but there's actually people seeing that this can be a good market because it's a healthier account base, client base. MedSup resurgence, you guys all felt that this year. I know that it's something that you guys have either started to look at or whatever. I know when Chris talked about INA and that product, the Chubb product, that's an all-year pay commissionable product. That's exciting. And if the rates increase, your commission increases. So that is really fun to see. Kind of looking for the silver lining here. And they've talked a lot about helping and supporting, agents and putting on T65 seminars. They want that business. So I think that's where some of their marketing funds will go to you. We talked to a bunch of the agents here, and you heard a lot about using seminars. Please look at us when it comes to talking about Leading Resource and other seminars that we know are successful in the field that we can help you bring out. Some of the things that they were talking about, they needed to diversify. We talked a lot about that, but Julie talked a lot about running her product, her company more like a business than ever. And I'll just kind of set that aside and talk about what we're going to do later in the year. We talked a lot about IFC and the concierge and the gold experience and all that kind of stuff. But we also have Todd Stead on the group side along with Gintis. And ICHRA's become a very big piece of people's product line here coming out along with the ACA idea. So we'll be doing a lot of training. Frankie's putting a lot of training together for that. We talked a little bit how marketing impressions look. Mitch talked about, along with a postcard and an email, they start to put a face with the name, and that's how marketing impressions work, just kind of marketing 101. But you got to be able to get the quality out of your quantity. And it become I think Julie and Sarah talked about how much they became community leaders this year, meaning they're bringing content to different groups of people. I think that's fantastic. And she used the topics by listening to her own clients, what topics they were talking about. And that's just fabulous marketing, and that's just paying attention. That's being a steward that's doing the golden rule we talked about. Remember that we talked about the gold experience. And the reason the gold experience is kind of built is you have a relationship that Gabe Isaacson's another podcast I did earlier this year. It was amazing. You should watch it. But Gabe was from McKinsey. And McKinsey, he worked with integrity, and he was so good that Brian Adams said, "How do I get you?" So they actually hired him away from McKinsey to be at integrity. And Gabe talks about the fact that an insurance agent's email or letter will be open 40 to 60% more than anything that comes from the insurance company that he's representing, because you are top of table when it comes to who they respond to before the plethora of stuff they get from insurance companies. We've been talking to the insurance companies about this, and that's when they perk up. How can our agents help drive, better fall practices, all those type of things. So expect the relationship between the healthcare delivery and you to become more synergistic, but it'll also become profitable. I got some popcorn in my throat. Imagine that. Anyhow, in closing, I told you guys in Minnesota we're badasses, and I really meant that. So me and my wife got really enamored with the buffaloes. I spent some time in South Dakota now. We're marketing out there, and they're huge, majestic animals. And what I learned about buffaloes, or they call them Tatanka in the Indian language out in South Dakota, is that it's the only animal in the world that when a storm comes, it hunkers down and goes through and runs through the storm. So it spends the least amount of time, and it gets their young ones and their community through the storm as fast as possible. And that's what you guys did. You didn't avoid it. You didn't run from it. You knew it was going to suck. You kind of embraced the grind, and you ran into it. Well, I thought it was so cool. I have an artist that's a friend. His name's Joe Burns, and this is just a print. But this is what I had him do, and I had him build out I have a big, like 5-foot one of these. And I gave this to all my people that were at my holiday party because they are all Tatankas. They're badass individuals that saw the risk, saw the problem, and they went headfirst just like you guys did. And I want you guys to know and feel that the IFC supports you because they get it. They understand what you're going through. And one other thing I want to say, I'm going to go to Q&As and I'll quick wrap up. But one other thing I want to say, and Ryan Kimball mentioned it, I've become more active back of the scenes than I've ever had to have been. You know, it's 23 AEPs for me now, and this has been the most trying. But it's forced me to become very involved in NABIP. I'm going to Capitol Hill on Sunday for the next week, talking to senators. I'm meeting with people like a great agent, Greg Davids, is helping us see people at the state. We're talking with people like Tom Wright and Tim Wilkins and all these people that are trying to make some changes. And the reason I'm saying this is we do a lot of this behind the scenes, but you guys need to also look at making sure at least people know. I want to thank a couple agents that in the field this fall really were willing to show us our warts and tell us what we needed to do. Dave Freeland, Mr. Mitchell Tree, Clay Wallace, everybody that was on here, Mary McClure, God bless her. She would find some of the most interesting problems that she had to do, and we were stumping the insurance agencies with some of the problems she was coming across. And I know there's a number of you also, Pat also, and a bunch of other people that I really want to thank for keeping us on our toes. And it's not complaining, it's making us better at our game. So a bunch of questions did come through before we had technical issues, so we put the Q&A page. But one of the big ones that came in through was, what is the commission splits for concierge service? And Don talked a little bit about that. It's really all over the board. There's an MDRT split deal that says every part of the sale is worth about 20%. There's the finding the prospect, setting the appointment, making the pitch, making the sale, and servicing it. 5 positions in that. And whatever they kind of work, it's, either you share that, you share it. So it could be anywhere from 20% to 80%. If you want to learn how to fish, it could be a quick 50-50 to teach you how to sell that product, and away you go. Do the carriers expect to withhold commissions for 2027? I have no idea. The reimbursement rate is going to be a big piece of that. Everybody's saying that this is cycling out. You heard both Ryan and you heard Chris Kolowich talking about some answers that are coming down the road for this fall already. So we're hoping we're going to have options. I don't think it's going to be across the board. Everything's back to the way it was, and it may never be. But I think there's going to be a lot more silver lining than what we had last year in the fall when we were just trying to find a narrow corridor to win in. What are the carriers doing to make prior authorization better in Medicare Advantage plans? The new CMS rules actually is dealing with some of that and making prior auths, and they're just kind of getting some of the costs and the prior auths minimalized down to only a couple of lanes now where you need to have that done. So we had some other questions and whatnot that are in here, but they talked most about helping and getting marketing dollars. One of the big questions we get asked is, are we going to do a agent celebration this fall? And the answer is we're not. We've decided to move those funds to help you guys market out of this issue. What we are going to have this fall is a best practices. Kind of like Julie talked about being better in her business. We want to help you. So we're going to bring business leaders, tax leaders, marketing leaders, AI options, and we'll have a day of just kind of a mastermind class of moving your practice better. And then we'll talk a little bit about scaling and sale. And I'm sure there'll be a happy hour, but we're not going to have the big entertainment. It's not going to be overnight. And we'll try to deliver Cs all year long in either webinar or face-to-face things, but we're just not doing the big deal. This was a hard year for everybody in everybody's pocketbook. It wasn't something that we feel we needed to celebrate as more as we needed to really support and become your back room and be in your corner. Well, if you know anything about us at IFC, kind of in closing, so we came up that this is Tatanka, this is the buffalo, and what we decided is that it's a super good cheers to say, raise a glass. So if I raised a glass, a very big glass, because this fall needed a very big drink, then everybody at IFC who's in your corner is saying Tatanka to you for being badasses in the market, similar to a Buffalo, and cheers.